I'm Sally Pace, and we are so excited that you all are here. A few years ago, we started the Granite List as a needed resource for benefits leaders, helping you cut through the clutter and streamline the process of finding solutions. And today, the site has grown to be the most trusted resource for benefits leaders as they're searching and sourcing solutions. And we've seen that become evident in the searches that you all perform, and certainly the way that they've changed since our inception. And Ryan, I'm so excited that you've pulled this presentation together, because one of the things we've certainly seen a shift in is that once highly nuanced and unusual term, virtual care, that even my father-in-law, that is, I won't call you out on your age, but he is aging and had to do telehealth visits during the pandemic. But now there's this new shift to what is being referred to as hybrid care. And so I'm really looking forward to today's discussion. And let me tell you a little bit about who you're going to hear from. First of all, Ryan Schoenecker is spent the past 2 decades in emerging business, driving adoption of and the use of virtual care solutions. In his role as Chief Commercial Officer at Vori Health, Ryan runs the commercialization and growth of Vori's offerings in the marketplace. Prior to joining Vori, Ryan was on leadership teams expanding the solutions at Icario, Teladoc, and Virgin Pulse. Ryan received his bachelor's from the University of St. Thomas, an MBA from Notre Dame, and Mendoza School of Business. Again, that's my Southern coming out, Notre Dame. Tom Armani is the Director of Global Benefits at Dayforce. He's a human resource professional with extensive expertise and experience across all areas of employee benefits, including healthcare, life and disability, paid time off, and retirement programs. He has strong functional and technical backgrounds developed through working in lean environments that require a direct, hands-on approach to program creation and management. He's a disruptive innovator with strong passion for developing creative solutions with his eye on the bottom line, lean management. Ability to establish credibility and rapport across diverse audiences ranging from union members to board members is Tom's area of expertise. So with that, I'm going to turn it over to you, Ryan and Tom.
Thank you, Sally. Well, thank you everybody for joining us today. We're going to give you a little overview of who our organizations are, some of the challenges that are out there with virtual first solutions, and the evolution that everyone's trying to make and scrambling, as you'll see in the marketplace, to try to also offer in-person care. So this hybrid approach to care is really what we're going to be focusing on today. And Tom, you want to kick us off and talk a little bit about Dayforce?
Yeah, I would love to. I joined Dayforce in 2020. I joined Ceridian in 2020, and I'll reveal something about my age, but I remember going back to the 90s where ADP and Ceridian were kind of the two behemoths in the payroll space, and Ceridian had a whole bunch of other stuff it did. But I'd say that in recent years, we've really stripped down and focused on our human capital management product, which is called Dayforce, and really seen amazing response to Dayforce as an award-winning human capital management system. And so as a result, we decided to rebrand, and now we are Dayforce as an organization. It really is an amazing organization to work for. We continue to grow globally. It's pretty cool. We just added Denmark, which I would love to go visit. Our brand promise is makes work life better. Our core values are customer focused, shared ambition, optimism, agility, transparency, and equity. And we've got a strong commitment to corporate responsibility and sustainability. So it's a great place to work. Back to you, Ryan.
So Tom, as you're thinking through, I think obviously people on this call are interested in hearing about, as you look at solutions out in the marketplace, what do you look for as far as criteria for how to select something for your employees that's going to meet their needs and obviously be a worthwhile investment for you?
Yeah, I don't know if I'm an anomaly or just strange in that I really, like in a wonky way, like this space and like to do a lot of my own research. For me, what it comes down to really is two potential things that the solution is going to do. Is it addressing a spend driver? Will it mitigate long-term trend, long-term cost? Again, are there clinically validated guarantees, ROIs tied to the solution? So one of it, is purely in the economics of me trying to be a good steward of the long-term spend of the health plan. I'd say the second one is, there continues to be a war for talent out there, and again, companies want to attract and retain talent, and so, does the solution either address an unfulfilled need, or will it bolster the overall positioning of our benefits program, which is driving employer value and recognition as an employer of choice? So I'd say that's where I start, and it could be both, right? We've added some solutions that have nothing to do with ROI, and others that have everything to do with ROI. Other factors that are important to me: how tough is it going to be to kind of get the solution through from approval to implementation? Again, do I need to go through procurement? Do I need to get legal involved? Does the vendor have a relationship with my ASO carrier where I can do it as a pass through? How am I going to pay for it? Do I need to secure a budget? Will it be passed through as a claim? How easy is implementation? Again, how does it fit into the ecosystem? How willing is the vendor to partner with me so that I have influence on the solution and can help with respect to continuing to bring my perspective and potentially add value to the long-term roadmap? And then, at the end of the day, I go back and I really also involve my consultant and value their opinion, but it's typically not done until after I've done my own research.
So as you are, taking all this into consideration, doing the research, and then thinking specifically about applying this to the virtual musculoskeletal care space, which is really what we're in, and we'll talk a little bit more about that. But what were you looking for? What were the challenges you saw in your business, and what did you lean on for making a decision in that area?
Yeah, again, I've been in a benefits leadership role for 20 plus years, and throughout my career, MSK has always been, a top spend driver. So, it still is. And it's not just on the health plan side, but it's on the disability side as well. And again, in a prior role, when I was in a more union blue collar operation, it was even more relevant. It's not that it's not relevant now, but we had an aging demographic. So I've always had a keen interest in MSK. The key challenges for me, first and foremost, were to find a clinically validated solution, one where it wasn't all about surgery avoidance or perceived pain reduction, but again, show me the numbers, like show me an actuary that wants to jump in and demonstrate those numbers. I'd say that I think all the solutions that are in this space are great, and I could name some of the others. I won't, but I think it's better that you have something than nothing. And if you want to really take the time and try to understand the differentiation, you're gonna end up someplace. But again, what I spent my time doing was looking for those small ways that the solutions differentiated themselves, and that was really important to me. What's also important is how are the solutions evolving, and what does the roadmap look like? Again, when these first came out, the space looked a lot different. Now there's focuses on prevention, on acute care, on chronic care, on pre and post surgery. You're seeing an expansion into women's health, pelvic floor, and pain management. So, again, really trying to understand what they do, how well do they do it. From a technology perspective, again, different vendors have different approaches. Some have wearable sensors, some are based on computer vision. And then what roles do the different professionals play, whether, again, it's a board certified doctor, it's a doctor of physical therapy, it's a physical therapist, it's a coach. All of that is very challenging into really trying to refine down what a solution has to offer and what those subtle ways of differentiation are. And then, from a table stakes perspective, again, a lot of this is repeat, but first and foremost, again, what is the ROI, the clinically based ROI, and again, can I get guarantees? Can I get SLAs, fees at risk? The technology is really important. Not only how does the current technology work, but how's it positioned for the future? Again, how does it fit in with my overall healthcare ecosystem? What's the participant experience like, both with respect to who the participants are interacting with, but also what's the environment? Again, one of the things that attracted me to Vori was that it offered both a pathway that was virtual, as well as a pathway that was brick and mortar. But I think that we'll leave it at that for now.
Okay, great. So I think, things you just pointed out about the space, it is a high cost claims area for everybody. And this has been for a long time. So your point about action versus inaction is critical, that doing something is really important. And I think you talk about the kind of early stages of companies in this space. When our co-founders started Vori, they looked at that model and said, okay, virtual PT is one thing, but the only way to really make a difference and be able to impact more members and truly impact the claims is by setting this up as a medical practice. So Vori Health is a nationwide medical practice that specializes in musculoskeletal care. We're in all 50 states and DC, and it's for us having doctors involved in care, and every single member works with the doctor. But by doing that, what that means is that we're able to treat 40% more musculoskeletal conditions than anybody else in the space. Those are conditions that usually tend to be a little bit more severe. And it's where you actually need a doctor involved in care for those individuals. So they realize this is the first thing we need to do is make sure we're doing this differently than anybody else in the space. They also realize that there are, headwinds related to, some people adopting virtual only solutions. And so they knew that, yes, sure, we'll start with virtual first, but we also need to make sure we do this migration into more complete care, that somebody can go hybrid, which we'll talk about in a little bit here too. For us, the technology, being able to get out in front of that and make sure that we are in a spot where you don't need to track down any other device or sensors or anything like that, to make it as simple as possible from a member experience perspective. But when you look at the world of why are healthcare costs and why are MSK costs so expensive, and quite frankly, for a lot of people, out of control as their number one, number two, or number three high cost of claims area, it's because most care when it comes to MSK care today is delivered from primary care physicians, who then say, okay, well, what we need to do is do some imaging, and the people to read that imaging is a surgeon. If you think about this in any other context, think about cardiac care. If you go to your PCP and they're like, great, let's do some tests and then have a cardiothoracic surgeon take a look at you, you would never do that. But for MSK care, you do. So the person that's missing in that care journey is the equivalent of a cardiologist. And that's who we employ. That's where the doctors are that you're working with. These are people who know how to actually treat you in non-operative care for your condition that's going on. People today, it's really confusing trying to understand the healthcare system. You can see it on the left side here. They bounce around a lot when it comes to musculoskeletal care. So for us, as the founders started the company, they said, okay, what do you really need to treat somebody and care for someone? You need a board certified physician, you need a doctor of physical therapy, health coach, and registered dietitian. And let's bring those four people to work with individuals and help them to simplify the process. And so that's what they've done. And then this is the tool set that our team has available to them. So Tom mentioned a little bit earlier, there's other things that are pre-op, post-op type aspects to the service. Absolutely. There's preventive stuff that we do. That's also obviously part of our normal care journey. But you do see some interesting things on here that people sometimes are surprised by, like smoking cessation. Why, Vori, why would you do smoking cessation? The reason why is because as you take a look at an individual who's thinking about some sort of spine surgery or doing a graft on their bone, if you're an active smoker, you're 90% less likely for that to actually work. So what our team will do is prescribe Chantix, do health coaching with them, and let them know, we're not trying to make you quit smoking forever. If you do, great, but that's not the goal. The goal is to make you have a great outcome with this procedure, because nobody wants 2 back surgeries. So helping them and knowing that here are all the different resources that are available so that you don't have to just ship them off to some other person or back to a PCP to get something else done. When people come to us, they're coming to us for a lot of different types of conditions. We tend to throw them in 3 categories: acute, reoccurring, and chronic. helping people to understand that sometimes your care journey is going to be a few weeks long, sometimes it's going to be 7 or 8 months long with us, helping them get the care that they need. So as I mentioned, we started this journey and said, all right, we need to make sure that not only can we have a solution where doctors are working with you and making it as convenient as possible for you at home, but there are people who just have the hesitation and say, I also want to just go in person. So for us, the way that we set up our program is that people can start virtual and then they can flex and go in person if they want. So we know that, I think a lot of people know, the stats of trying to access care are challenging for people. So trying to see a specialist takes over 20 days. That's, if you've got a back problem, for anybody who's had that, you don't want to wait that long. And so people tend to access care at the wrong places. So for us, trying to make this simple is really, really important, especially people who are getting some form of physical therapy. I think a lot of people quit physical therapy. Only about 30% of people who start physical therapy in the traditional way of accessing it actually complete their care. And it's for a few reasons. One is, I don't know if you've ever done it, but a lot of times people will drive 10, 15 minutes, get to the physical therapist in person. It's a 15-minute session, then drive 15 minutes back. And every time they go, usually the way plans are set up is that you have to pay a copay every single time. Well, if you're on a care journey and you need to see a physical therapist 20 times and you're paying $30 a time, that's $600. It's really expensive. So, companies like Dayforce having the foresight to understand that these are some barriers we want to reduce for our employees and for their families are really important to be able to access that so people do complete their care plans. So we all know the positives, virtual care, great. And we also know that during the pandemic, as you take a look, everyone jumped in that. And Sally mentioned at the beginning too, even within her own family, but seeing that spike of how people started to use telehealth, and then you started to see a downward trend after people could have the choice to go to doctors. But the story didn't end there. So it continued. So all of a sudden we did end up seeing a normalization of virtual care. What you're seeing on the screen here is a percentage of people who have accessed care telehealth use within the previous 4 weeks. So not bad from a standpoint of how many people continue to use that. But we don't really need to swim upstream all the time. And so that's kind of why we created our hybrid offering, because people are going to see things however they want to see them. Some people are going to say, virtual first and virtual only is the absolute best way to do it. Others are going to say in-person care. So for us, it was really important to try to put a solution in place that really could be available to members to use our services however they want. When we looked at building this out, it was hard. And it's a long process to do this. It took us over 18 months to build this out. We're now offering services in person in 200 largest metropolitan areas across the country. There's more coverage in that, but that was really kind of how we set this up and the evolution of trying to build this. So throughout that 18 months, the slide of here are all the different locations that we're in continued to build and build. And we're proud to say that we've got that up and running in 200 largest metropolitan areas, a little bit more than that, but helping individuals know that, hey, if you think that you need to get care in person, great, let's start your journey with our clinical teams. And so that's what ends up happening is people will do an intake with our doctors and physical therapists who are then doing an intake, creating a care plan for them. And if they decide to go in person, what we're doing is we're then transitioning that care plan to the local PT in person and helping them understand that when they show up, they don't have to pay a copay. They don't have to show their insurance card or anything. They'll show up and utilize our service, and those local PTs are following our care plan and then feeding information back into our system. So our doctors still remain at the core of that team's care, and people can still continue to message back and forth, and or if they want to come back and continue to use our virtual services, they're more than welcome to do that. Or if they want to stay in person, they can do that too. There are certain reasons why people would need to go in person, and there are other preferences that we see. So if someone has a balance or a gait disorder, you can see an image here of how someone may need stability bars as they're doing some physical therapy. Those are great reasons to send someone in person. Sometimes with traction therapy, people just aren't comfortable using some of the equipment on their own, or they don't understand how to do it or need to go in person and have someone set that up for them to start with. Those are other reasons. And then what we tend to see is that by removing this barrier and making it okay for people to be able to say, I don't feel comfortable with virtual only, I want to go in person as well, we see 3 times higher utilization typically than our clients who have virtual only offerings, because whether the person chooses to go in person or not, knowing that they have that option really makes them more comfortable with these types of solutions. We're the first to do this, and you're starting to see some of the other just telehealth companies in general that are also trying to set up in person, because they know that offering this is really the future of care. So for us, what we've seen with populations that are choosing to go in person, who start virtual and then go in person, 45 years old plus, and suburban individuals, and also people with gym memberships. So if you think about the psychology behind that, of someone who is, goes in person to an actual gym to do a workout, there's something in that same mindset as what we're seeing, but how they want to do more of the in-person care as well.
Yeah, Ryan, I'd jump in and say this was definitely one of the things that attracted me to the solution. Maybe we were actually a little bit too aggressive, because when we first came out of the gate in January, we were trying to make this no cost, regardless of setting, virtual or brick and mortar, across all of our health plans. And as we started to get into it, we got a little bit of pushback from council on, with respect to our high deductible health plan. Maybe we were being a little bit too aggressive in the brick and mortar space. So we've actually bifurcated it, and for those on a high deductible health plan, we've removed that brick and mortar option, which I was sad to do. But we'll see how things develop in that space and where that goes. So right now, again, for people on our copay only plan or PPO plan, they can go to either setting, brick and mortar or virtual. And for those on our high deductible plan, theirs is only virtual.
Yeah, and it'll be great to be able to track, and it's obviously what we're doing is tracking utilization by those different groups, and obviously spinning up a different microsite with different FAQs and different engagement materials for that population, just to make sure they know, okay, here's what's available to you and for one group, and then for the other subset, a little bit different optionality. From a utilization perspective so far, so just 2.5 months into the program, 3.5% of your population has already used us and use our services. So definitely your inclination was right. There was a need within your population for an alternate path for receiving care for your members. And obviously we'll continue to track utilization throughout the year, but a great start to kick that off, and for getting that many people to come in and start working with our doctors and receiving the care that they need so far. So Tom, you'd mentioned earlier too, just some of the ease of the technology, or making sure that the member experience is sufficient for your population. From what we're trying to do and how we're reinventing this space, you can see on the left side of the screen here, our sensorless motion tracking. So you'll have an individual that will just go in front of any sort of device that has a camera on it. So it's either your phone, your computer, a tablet, whatever you prefer to use, and be able to track your exercises, because obviously there's synchronous work that you're going to do live with your physical therapists and your doctors, and there's asynchronous work that you're going to do on your own as well. So as you're doing that, rather than the typical way that usually you're receiving your document that says, hey, go and do these exercises every day and I'll see you in a week. What we're doing is we're actually giving corrective feedback to that individual through the technology. So it'll give them positive reinforcement as well as corrective feedback, and score their activities. Your clinicians also, it records the skeleton of you doing this compared to the skeleton of the person that you're trying to mirror. And that goes to your clinical team as well. So they're seeing what's going on with you. And then on your next visit with them, your physical therapist is going to walk you through that and give feedback tips, and then walk you through new exercises to take on. But making it as simple as possible, not having to lug around any sort of other device or keep it charged or whatever else, really for us is what's been allowing us to stay connected to individuals and make sure that they're graduating. I call it graduating, but our clinical team calls it being clinically discharged from our program. I think our clinicians are probably most proud of the number you see on the right side here in the middle, which is 85% of people who do an initial intake with our team, use our services consistently all the way through, and reach their goal and clinically graduate or clinically discharge from our program. So setting up an easy to use solution that's accessible for members wherever they are, is really important. And then obviously this evolution of moving to hybrid care and allowing people with these options is really the focus of our business and what we've been working on, as I mentioned, the last 18 months. So we're happy to share the story with you. Tom and I are happy to answer any questions you have as well. And we only have about 3 minutes left. The session's quick. So happy to pause there. Any other comments or thoughts, Tom, before we take questions?
No, I mean, I guess some of the other things I was thinking about as you were going through that I would ask is, again, do you get charged differently for multiple body parts? So again, if I've got a knee issue and then later on it's a back issue, how does that work? For other things like pelvic floor, for in the women's health area, again, is it included? Is it an add-on?
Yeah, great question. So it's and you're right. Other participants here are, I'm sure, wondering the same thing. For us, the way that it works is that when you come to us, you are taken care of for 365 days for whatever your condition is. So there's not additional charges for that. So coming in and utilizing our services, maybe you are working on your knee and things are going well, and then all of a sudden you also tweak your back. It's your same care team that you're going to work with, and you can access them and just continue to work with them for an entire year.
All right, so we've got a couple of folks that are using the chat to ask questions, and one is, can you share your pricing model? Is it PEPM, fee for service, et cetera?
Yeah, so we offer PEPM if people want that, but the vast majority of people don't. The majority of people want to do case rate pricing with milestones. And so what that means is you're only paying for the people who are using us. And then on one of the earlier slides, I showed the people who are acute injuries, recurring, and chronic. You're paying differently for the clinical severity of the members. So you won't pay the full price for somebody unless really they have a chronic condition. For someone with an acute condition, we don't believe we should charge you the same for someone that we're only going to work with for 3 weeks versus someone we're going to work with for 9 months. So the pricing is set up that way, and be happy to talk to you more about that.
Yeah, and it was really important for me to understand, again, what triggers an outcome milestone. Again, if somebody's logging in and just reading something 3 months later, does that trigger it? So we don't need to get into the answers, Ryan, but again, just something to think about.
Yeah.
Another question that came in is there a geographic pattern of usage that you see in the data for Vori services?
Yeah, so the groups that we see for higher utilization are people in rural settings, obviously, because access to care is just more challenging there, as well as people actually in urban areas. So suburban, if you look at, they have the lowest utilization of the different groups that we've got. And there's probably a variety of reasons for that, but the definitely being able to provide access to care and then the difficulty of just getting to locations. I think those are some of the things we routinely hear from our members of why they're using the services.
Interesting. And Tom, you mentioned the importance of finding solutions that were validated. And Ryan, I know you all have gone through the rigorous validation process at Validation Institute. Do you mind sharing a little bit about that?
Yeah, so not only our ROI is validated by Milliman, you can go on Milliman website or just Google Milliman and Vori Health, and you'll see how we do our ROI methodology. And then from a clinical outcomes perspective, yes, we went through Validation Institute for that on our findings. Tom, how do you think about that as you're looking at other groups?
I mean, that was huge, and again, I that's where I brought the consultant in, and I said, this is what they're selling me. Is it true? So.
Tom, there's a question that's come in for you, and it's, do you mind talking about how program utilization has been going? I guess, Ryan, they're asking to talk about you in front of you. How is program?
Oh, I think part of the difficulty in our role as the benefit professionals is from a privacy perspective, unless people are self-disclosing that they're using programs. And typically they're doing that when they're not happy with them. We don't have a direct pipeline of feedback. What I can tell you is we've done some webinars out of the gate where we had really good participation and that drove utilization. I haven't heard anything negative, and in reviewing participant feedback related metrics with Vori and comments that have been captured, everything's been positive so far. So it doesn't mean there isn't dissatisfaction out there. It hasn't come my way, but I'm optimistic that people like the program.
Unless yours is a wildly different organization. Usually you hear about the squeaky wheel. So
Yeah, absolutely.
I would take that as
Yeah.
an affirmative. Well, I know we have come up on our time. Thank you both very much for participating today. Thank you. Huge thanks to Vori for being part of the Granite List community. Certainly people can find out more about Vori on the Granite List, but Ryan, if folks have direct questions, do you mind sharing how to best get in touch with you?
Absolutely. Yeah. I think reach out to us. I can, after this, we can send contact information as well as go to our website and there's information on there of how to contact our team to ask any additional questions.
And if you're looking for an award-winning human capital management solution, you can look me up. I'm just look at that plug-in. So
Absolutely. Well, thank you for joining today, and thank you all for being part of the Granite List community. If you have not created a profile on our site, we encourage you to do it, thegranitelist.com, and we will talk to you soon.